Thank you for joining me today for a fresh look at self-directed waiver services. My name is Kim Mobley, and I work in the Office of Medicaid Development and Administration at the Ohio Department of Developmental Disabilities. Let's take a look at today's agenda. I'll begin today's presentation by sharing some history and background on the evolution of self-direction in Ohio's DD waivers. I'll then share the department's vision and actions we are taking to support the growth of self-direction in our waivers. From there, I'll provide a refresher on the basics about self-direction so that you, as an SSA, feel better equipped to inform people about self-directed options for service delivery. I'll review the key roles on the support team who help make self-direction successful, and then I'll share additional self-direction resources. Finally, we'll discuss how you can be a self-direction champion. Let's get started. Self-directed services were first made available in Ohio's DD system in 2012. The department created the Self-Empowered Life Funding Waiver, otherwise known as the SELF waiver, which offered 5 services people could self-direct. Over the years, opportunities to self-direct have grown. Currently, the SELF waiver offers 5 services that can be self-directed. The Level 1 waiver offers 4, and the IO has 2 services available for self-direction. While offering a variety of self-directed service options across our waivers is a good start, the department continues to receive feedback from people with lived experience, families, and advocacy organizations that self-directed services are underutilized, and we agree. Moving forward, we want to do more. DODD has been taking steps to demonstrate our commitment to self-direction. In the spring of 2025, we created a position focused specifically on growing awareness and utilization of self-directed services. The department has also worked together with the organization called Applied Self-Direction and with our community stakeholders to create informational materials. These materials will be shared via social media and will be available in toolkits on our website. This training is also an effort to refresh SSA's awareness and understanding of self-directed services. In the fall of 2025, we will continue to expand our efforts by offering additional training for support brokers. We want to ensure support brokers are well equipped to work with people who choose to self-direct and have a firm understanding of how to collaborate effectively with SSAs and the Financial Management Service, also called the FMS. In early 2026, we look forward to expanding the availability of the support broker service into the Level 1 and IO waivers. We believe the support broker role is an important element for ensuring a person's success self-directing. Not only that, but the support broker will be of value to SSAs by taking on the responsibility of working hand in hand with people who wish to self-direct. We will talk more about the role of the support broker later in this presentation. Finally, DODD intends to move toward expanding the availability of participant-directed goods and services into the IO waiver in a future waiver amendment. Our focus today will be enhancing our SSA's understanding of the self-directed services landscape. Our expectation is for you to keep self-direction top of mind for people who desire more choice and control over their services. We recognize there may be barriers, such as gaps in knowledge, that impact your confidence talking with people about the option of self-directed services. Today's presentation will help close those gaps and will empower you to have more confidence when discussing self-direction with individuals and families on a routine basis. This presentation will also review the relief support brokers offered to SSAs while supporting people who choose to self-direct. Another way we will support the SSAs today is by reinforcing a shared understanding of the roles and responsibilities of the SSA versus the support broker versus the FMS. Understanding how each role supports the person as well as each other will increase your confidence working with people who choose to self-direct. Let's start with some basic information about self-direction. What are we hearing from people with lived experience, advocates, and family members of people who self-direct? Self-direction embraces responsibility, not in a heavy or burdensome way, but in an empowering way. It facilitates a sense of ownership in one's own outcomes by allowing a person the opportunity to shape and mold their services and approved budget to their personal specifications. Self-direction is about choice, control, and empowering a person to take the wheel managing their services. It's a culture shift from the way services have been delivered historically. Self-direction gives a person more control over choosing who provides their services, when their services are provided, and how they are provided. Self-direction affords the person a higher degree of flexibility. It expands the pool of potential service providers beyond the traditional agency model. It allows the person to have more options for scheduling, budgeting, and managing their services. For people who use the homemaker personal care service, self-direction can be a creative way to address staffing shortages. Family members and friends who the person already knows and trusts can become paid caregivers, and there are no limits on the number of workers a person can employ. This is called participant-directed homemaker personal care and self-direction. Self-directed services often result in more consistent and reliable staffing, fewer missed shifts, and greater continuity with providers. It's easy to understand why people who self-direct report being more satisfied with their services. The DoDD waivers offer a variety of services that may be self-directed. Participant-directed homemaker personal care and self-directed transportation are both available across all waivers. Support broker is currently in the self waiver, but will be incorporated into the Level 1 and IO waivers in early 2026. Clinical therapeutic intervention and participant-directed goods and services, PDGS, are both available in the self and Level 1 waivers, and the department is working toward making PDGS available in the IO waiver. You can also see here which services offer employer authority, budget authority, or both. Budget authority is when the person is able to make decisions on how to manage their self-directed services budget. Once the budget is determined based on assessed needs, the person has the flexibility to move funds between various waiver services. For example, let's say a person on the self waiver has $10,000 allocated to participant-directed homemaker personal care and $500 allocated to participant-directed goods and services. They spend their $500 PDGS dollars on a class that helps them achieve an outcome in their ISP, and then they learn about an opportunity to take a class in another area related to their person-centered outcomes. The next class also has a cost of $500, but the person already exhausted all the money allocated to PDGS within the span. Because the person has budget authority over these two services, they are able to request to have their SSA update the ISP to transfer the additional $500 from their PDHPC budget into their PDGS budget, allowing them to register for the upcoming class. This leaves them $9,500 in their PDHPC budget. People with budget authority for PDHPC are able to negotiate pay rates with employees. This flexibility allows a person to get more out of their PDHPC budget than they would by using a traditional agency. The person can negotiate a rate of pay that is less than an agency would charge, thereby stretching their budget further. Another example might be someone who lives in a remote location where it's difficult to find staff. They could offer a higher rate of pay for workers, making it more appealing to potential staff. Offering a higher rate of pay within the Medicaid guidelines can help recruit as well as retain workers in hard-to-serve areas. In this example, where pay rates are higher, the budget doesn't stretch as far as a lower pay rate, but this approach may increase a person's likelihood of attracting and retaining staff. People in the self and Level 1 waivers who have budgets for PDGS have choice in how much they pay for goods and services. They can shop around for the best deal on items that support their needs but aren't covered by the waiver. This is a great way to maximize their budget. We've included a link to our YouTube video on budget authority as a resource for those who would like more information. Employer authority allows a person self-directing their HPC service to employ workers directly or work with an agency to employ workers on their behalf. The benefit of employer authority to the person is that they get to handpick their direct support staff and manage them directly. There are two scenarios for employer authority: common law and co-employer. In a common law scenario, the person is formally the employer of record for their support staff. As a common law employer, the person has full control over hiring, scheduling, and managing their direct support staff. In a co-employer scenario, the worker is employed by an agency with choice or by the FMS on behalf of the person, but the person participating in services recruits, trains, schedules, and manages their staff. People may wonder what the benefits are to an employee working under a self-directed common law employer or under a co-employer model. The benefit to the worker is that they receive training directly from the person on their unique needs and preferences, and they are covered by unemployment insurance and workers' compensation under their employer. This may not be the case if they are working as an independent provider. When the person is the common law employer, they are the employer of record. They control who provides their care and how their care is delivered. They have support from the FMS on all the paperwork aspects related to hiring and certifying their employees, as well as support with making sure taxes are accounted for. The FMS also supports by tracking the spent and unspent funds in the budget and making sure that the service records are accurate. When a worker is employed in a self-directed model, they reduce the amount of business management headaches they would have if they were working as an independent provider. When providing self-directed services, the FMS handles Social Security and tax deductions from the paycheck on behalf of the worker. They also work directly with the employee to ensure timesheet information is correct so that billing errors and delays in payment are avoided. As an independent provider, workers have to deal with these elements on their own or hire and pay a billing company to assist them. Working with a person who is self-directing can relieve a worker from a lot of administrative burden. In the co-employer scenario, the person remains in the driver's seat with the support of the FMS or an agency who acts as the employer of record. People who like the idea of self-directing but maybe want an additional layer of support with the employer responsibilities tend to choose this route. They may prefer the safety net of having another entity that can provide support with the recruiting and hiring functions, organizing the schedule, or even helping navigate difficult conversations related to employee performance. Agencies may offer paid leave and benefits, which can be a great perk. It's always a good idea for people to ask the agency what they offer employees before making a decision when opting to partner with an agency. Administrative support the FMS provides in the common law scenario is similar to the co-employer model, but with co-employer we add the option of using an agency in lieu of the FMS for those functions. What are the main roles aside from the person or their representative on a self-direction support team? Let's take a look. This slide is an illustration of the self-direction support team and their roles in the simplest terms. When you boil everything down to the basics, the SSA is accountable for the overall coordination of services and supports for the person. The SSA acts as a project manager, working closely with the person to make sure all the pieces of the big picture come together. Support brokers are an incredible resource not only for the person, but also for the SSA. The support broker has the capacity to get into the nitty-gritty details of self-direction with the person, much like a personal coach. They are able to address questions about the day-to-day responsibilities of self-directing, explain program rules, assist with recruiting workers, help with the interviewing and hiring process, and make sure the person is successful in their self-direction endeavors. Support brokers play a key role alleviating pressure from the SSA, freeing up the SSA to focus on other aspects of support. And finally, the FMS can be viewed as a human resources and accounting lead. They primarily assist the person with the self-direction onboarding process, timesheets, and payroll. Let's talk more about each of these roles. The SSA is the project manager. The SSA is responsible for the development, updates, and coordination of the person's ISP. They assess the person's needs, educate them on resources, and develop the ISP with the person. The SSA must authorize all waiver services and check in with the person to monitor that supports are provided as outlined in the ISP. They keep the plan updated, and the SSAs coordinate changes in services. The SSA is the accountable point of contact, much like a project manager, and they provide continuity for the coordination of services and supports. The FMS is the Human Resources and Accounting Department. The Financial Management Service works hand in hand with people who choose to self-direct. The person is connected to the FMS when they make the choice to self-direct services. The FMS will assist in establishing the person as the employer of record, or will collaborate with them as a co-employer if the person opts to share the employer responsibility with the FMS. The FMS makes sure all applicable employer and employee taxes are managed in accordance with program rules. If a person elects to use the agency with choice model for participant-directed homemaker personal care, the agency is considered the employer of record and manages all the employer and employee paperwork and payroll. In this case, the agency is not the FMS. For people using self-directed transportation or participant-directed goods and services, the FMS coordinates payments to these providers and assists the person with tracking their budget allocations. Once a person opts to self-direct, the SSA will make a referral to the FMS, who will assist with getting them established. The FMS is very similar to a human resources and accounting division in a business. They make sure all paperwork is complete, help oversee the budget, they pay for PDGS purchases and self-directed transportation from the person's budget, and manage payroll on behalf of the person self-directing. The FMS is paid for by the state, and there is no cost to the person or their budget for the role the FMS plays. In summary, the FMS is an important part of the structure supporting the self-direction experience, but there's one more key role that can assist the person successfully self-direct. Let's talk about the support broker. The support broker is very much like a personal coach for self-direction. And while a person is not required to use a support broker, having them as part of the team has many benefits. The support broker is available to dive in and help individuals with aspects of self-direction that may feel overwhelming at first. The support broker can assist with enrollment paperwork in conjunction with the FMS. They're also equipped to assist the person with recruiting employees. Support brokers can do things like help write job descriptions and post ads to find workers. They can assist with developing backup and emergency preparedness plans that would be set into motion if there was a caregiver no-show or an unexpected emergency. Support brokers can assist with interviewing potential employees or help people prepare for conversations about employee performance. Most importantly, support brokers can prepare people who self-direct to become comfortable and independent in their role as an employer, as well as independently monitor and manage their self-directed services budget. Ideally, the support broker is not a service intended for indefinite use, since the goal is to support the person's independence, not create dependence. However, we appreciate some people will need this safety net longer, while others may only rely on a support broker during certain periods. For example, a support broker might be needed throughout the self-direction onboarding process and during the times when new employees are being recruited, hired, and trained. Otherwise, a person may not require the service until a new situation or need presents, and that's okay. Intermittent use of the service is appropriate and helps preserve the person's budget for support brokerage. For people who intend to use the service for longer periods, they simply need to be mindful about staying within their budget. The support broker is also valuable to the SSA and families. They can relieve some of the pressures from the SSA, allowing the SSA to spend more time on person-centered planning and service coordination. Support brokers have the knowledge and capacity to provide more focused attention on helping a person manage their self-directed services than an SSA would have the ability to provide. Support brokers know the self-direction landscape and have the tools and the time to teach individuals and their families how to navigate self-direction successfully. They also provide another set of eyes and ears and communicate updates back to the SSA. Support brokerage is currently available in the self-waiver and will be added to the Level 1 and IO waivers in early 2026. The budget limit for this service is capped at $8,000 per 12-month service span. Now that we have discussed the basic structure of self-direction and the team members available to support individuals, let's review how it all gets put into motion. The SSA is typically the first point of contact and the first person to develop a rapport with waiver participants. This makes it a natural fit for the SSA to start the conversation about self-direction. At minimum, the SSA should review the option of self-directed services with the person at the time of waiver enrollment and annually. When providing a general overview of self-direction, be sure to include these basic components. First, the general benefits of self-direction. It supports an individual's independence, choice, and control over certain services and their budget. It also allows a person to select and manage their providers. Second, the SSA should discuss that people may self-direct independently, appoint a representative, or that a legally responsible person or guardian can drive the process. Be sure to mention the additional supports and analogies related to their roles, like the SSA is the project manager, the FMS is similar to HR and the accounting department, and support brokers are available as personal coaches. Agency with choice is another way to self-direct, participant-directed homemaker personal care using the administrative support of an agency. The services available for self-direction are based on assessed need and should be presented along with a brief explanation of how the SSA determines the budget. The SSA should also mention that people are able to blend self-directed services with traditional waiver services. It's not all or nothing. We understand it can be useful to have resources that help with conversations or to leave behind so people can think more about what you discussed. So, the department partnered with Applied Self-Direction and stakeholders to create tools that illustrate self-direction. These resources are available on our website for viewing or downloading. These materials are also a great reference for common questions and talking points. We encourage you to use them as well as spread the word to your peers and individuals you serve that they are available and how to find them. Visit dodd.ohio.gov and select You and Your Family from the menu at the top of the page. Next, select the Services tile. On this page, you can type self-direction into the filter field and search that way, or you can scroll through the tiles that are organized alphabetically until you reach self-direction. Once you reach the page dedicated to self-directed services, you have the option of selecting from a variety of short videos. And if you scroll further down on the page, there are printable materials that can be used for educational and promotional purposes. Now that we've refreshed ourselves on the basics of self-direction and the resources available to educate and support people's success, let's take a few minutes to discuss how we can be champions of self-direction. The easiest way to support self-direction is to talk about it. We mentioned earlier that the minimum expectation is for SSAs to discuss this option at initial waiver enrollment and again annually when conducting the reassessment. SSAs, however, aren't limited to discussing this just once a year. Self-direction offers amazing benefits for people. It empowers independence and autonomy. It develops leadership, organization, communication, collaboration, and management skills, all important skills that translate into the working world. Research shows that people who self-direct end up receiving more of the services they are authorized for, which reduces gaps in care and health and safety challenges. Have you ever pulled your hair out trying to solve the same challenge time after time? Self-direction can be used as a tool in challenging cases. Do you have someone on your caseload who's struggling working within a traditional agency model for homemaker personal care? Perhaps they live in a remote location that's hard to staff. Maybe the hours they need covered are not the norm, or they have trouble retaining providers due to other complexities. Participant-directed HPC allows a person to offer competitive pay rates that can exceed what a worker might earn through a traditional agency. Higher pay can make unique staffing needs more appealing to workers. Transportation can be a huge challenge, especially in rural areas. Self-directed transportation allows a person the freedom to choose their own provider and go where they want on their own schedule. Self-direction is a creative way to step outside the box with a fresh approach. The flexibilities for finding solutions through self-direction can be limitless. There are a number of myths and misconceptions in the field that have slowed the growth of self-direction. Let's talk about some of the more common myths. Some SSAs feel intimidated by self-direction because they perceive it as complicated. But knowledge is power, and no one expects SSAs to know all of the nuances about self-direction. Maintaining an understanding of the material in this presentation will equip you for a basic conversation. When a person is ready to take the next steps, there are resources available to assist with the onboarding and detail work. Support brokers can be authorized in the service plan to help a person with the next steps. Right now, support brokerage is only in the self-waiver. However, it will be expanding in early 2026 to the Level 1 and IO waivers. The person is eligible for up to $8,000 a year to spend on this service. The FMS is another resource and will also assist individuals with the process of becoming an employer and getting employees set up with payroll. Once the person is set up, it's just a matter of communication and coordination across the team. Leveraging the supports available is a key component to a successful self-direction endeavor. It's more work. That self-direction myth is easily debunked thanks to the framework we have in place to support people who choose to self-direct. Many hands make light work. As I've mentioned throughout this training, there's an entire team available to help get a person set up initially and to support them all along the way. Before long, the person is cruising along independently or with very minimal support. The myth that self-direction is only available to people with certain abilities or who have a very involved support network is exactly that, a myth. Self-directed services are available to anyone on any of the DoDD waivers, but there must be an assessed need for the service they want to self-direct. Waiver participants can appoint a representative if they don't feel confident managing independently, and guardians are also able to direct services on behalf of a person. The support broker service can also be used as an added layer of support to teach the person or their representative the fundamentals of self-direction. When people talk about self-direction, it's not uncommon to hear the focus placed on the homemaker personal care service. And while PDHPC is available in all DODD waivers, there are other services available to self-direct as well. The Self and Level 1 waivers offer participant-directed goods and services, and the person has flexibility on how their budget is allocated and spent. There's also self-directed transportation in all of our waivers, which affords a person greater flexibility and access to rides. Clinical therapeutic intervention is offered in all waivers, and in early 2026, support brokers will be offered in all waivers. So now, how can you be a self-direction champion? Here are some tips. Invest in yourself. Identify where you have knowledge gaps and seek out resources. Seek out additional training and know where the subject matter experts are who can help. You aren't expected to be the end-to-end expert on all the nuances of self-direction. You simply need a basic understanding of the model and the ability to explain it at a high level. Please don't shortchange the people you serve by not informing them about self-direction because you aren't confident in your knowledge. Seek out knowledge, fill those knowledge gaps. Knowledge is power, and knowledge builds confidence. Leverage partners in your network. You may have a champion or a lead at your county board who is the subject matter expert on self-direction. The FMS and support brokers are knowledgeable and know where to go for answers as well. DODD is a great resource, and we have materials available on our website to help. You don't have to figure things out alone. Help is available all around you. Just ask. Don't assume. Communicate. Don't assume people on your caseload aren't interested simply because they've never asked you about self-direction. And don't assume people aren't interested because they declined the last time you discussed self-direction. People change their minds. You can start the conversation anytime, but at minimum, remind people of the option when you're first developing their ISP and then annually thereafter. Make sure you're communicating with the team for those who choose to self-direct. You're in the project manager seat. Make sure you're checking in with the person, the FMS, and the support broker to make sure things are going smoothly. Communication is key. Be aware of biases and myths. Never underestimate people's abilities or the strength of their support system. Help educate peers when you hear biases or myths in conversation. Recognize the difference between important for and important to. It's easy to focus on what's important for someone, like good nutrition and exercise, but things that are important to the person are just as critical. Self-direction can encompass both, and you can be an advocate for both. I'd like to close today by giving you a challenge. It's time to implement what you've learned. I challenge you to connect at least one person with self-direction this month. Starting now, keep self-direction top of mind. Begin talking about self-directed services when you're creating ISPs. As you meet with people for their annual reassessments, start educating them on self-direction. Before you know it, self-direction will become a part of your routine conversations. You'll be amazed at the level of satisfaction people will have with their services. I promise you, you'll feel a sense of fulfillment as you empower people who have been waiting for this opportunity to manage their services and supports. Thank you for your attention today. If you have questions about self-direction, feel free to send us an email. If you have a success story to share, we would love to hear it. Our email is waiverpolicyta@dodd.ohio.gov. Thank you.